Guys, how are you doing? It's your nurse tutor Smiling Nurse. Today we are going to continue from our previous class. In the last class, we discussed the definition of nursing process, the history, and also we talked about the steps of nursing process. Today we are going to be discussing on the steps of nursing process. In the last class, I listed the 5 steps of nursing process, which there is an acronym for it, which is ADPI. But some school of thought said it's no longer ADPI, that is ADPID. Assessment, diagnosis, planning, implementation, evaluation, and the last one, which is D, is documentation. Okay, let's talk about the first step of nursing process, assessment. What is assessment? Assessment is a deliberate, systematic, and logical collection of subjective and objective data which help to identify and define the client's problem before the nurses proceed to the patient's care. About subjective data, these are data that are provided by the patient or client itself. Why objective data? These are tangible data or data that can be measured, e.g. we have height, weight, the vital signs, diagnostic test results, and etc. In assessment, the nurse uses therapeutic communication skills, including interviewing skills, observation, and also doing physical examination to obtain the patient's data to form the patient's health history. Using a standardized framework such as Gordon 11 functional health plan pattern to guide the data collection process. Gordon 11 functional health pattern is displayed above. This helps to guide the nurse on how to ask her questions. Okay, we can see there, we see sleep and rest. You'll be able to ask questions on how often does the patient sleep, how often do you rest, for how many hours, and so on. Nutrition also, we also see, how well do you eat, how many times do you eat in a day. It helps us to guide our data collection process. The second step is diagnosis, but here we deal with nursing diagnosis. So we're talking about the nursing diagnosis. What is nursing diagnosis? Nursing diagnosis is a clinical judgment about an individual, family, or community responses to actual or potential health problems or life processes. And this nursing diagnosis describes the patient's situation with reference to the goals and needs of the patient, and it also helps the nursing teams to prioritize and plan the patient's care appropriately. The nursing diagnosis, we have the NANDA International, known as NANDA-I. NANDA-I is a professional organization that develops and maintains standardized nursing diagnoses that are used worldwide. And this is how it works. When nurses collect patient data during assessments, they analyze their findings and uses NANDA-I to formulate an accurate nursing diagnosis that suits the patient's needs. And this nursing diagnosis helps nurses to communicate clearly, plan appropriate care, and also help deliver evidence-based nursing intervention. NANDA International has 4 categories or 4 types and 3 other labels under it. The 4 categories are the actual diagnosis, the risk diagnosis, the health promotion diagnosis, and the syndrome diagnosis, which we'll be discussing in detail in our next video. The third step of nursing process is planning. In this process, the nurse and the client develop a goals or desired outcome and nursing strategies that will help to reduce or prevent a further health problem in an individual. In the process, the nursing diagnosis should be prioritized and there should be a write-down plan for each nursing diagnosis. Okay, I'll be giving an example. Imagine a patient with open wound, and you're checking the NANDA-I, you notice that there will be a lot of nursing diagnoses related to a patient with an open wound. Okay, there will be risk for infection, there will be impaired skin integrity, and also there will be the patient will go through acute pain due to from the site of the wound. Okay, what are the plans that we have down for risk for infection? Then you sit down as a nurse and prioritize. I think we need to prevent infection first. Risk for infection, we notice that all the dressing used are sterile. There's antibiotics. Patient is on antibiotics to prevent infections, and also we ensure that during the wound dressing it's not contaminated. And also we notice that what we use for wound dressing, okay, during wound dressing, what are the solutions that we use that will help to promote wound healing, that is concerning impaired skin integrity. We will ensure that yes, the wound is actually healing, and also we give prescribed analgesic like PCM, pentazocine if the pain is actually serious. to like help to reduce the patient's pain. And you ensure that while planning, you develop immediate goals, intermediate goals, and long-term goals of nursing action. For example, your patients will verbalize less pain within 30 minutes of nursing action. And you also ensure that your plans or your goals follows the SMART acronym, SMART. X is for specific, M measurable, A achievable or attainable, R relevant, T time bound. You ensure that all the plans you are putting in place to help the patient are smart. Okay, let's talk about the fourth step of nursing process, which is implementation. Implementation. This is where the nursing intervention or plans are carried out, where the nurses actually follow through with all the decided plan. It includes monitoring the vital signs, wound dressing, educating the patient, administration of drugs, and health hysteria. The last phase of nursing process is evaluation. It is to determine if the goals for the patient's wellness have been met. You check if the patient's condition has improved, stabilized, deteriorated, or has been discharged, or the patient is dead. In a situation where the patient shows no improvement at all, what you are going to do as a nurse is that you are going to start from the beginning again, from the beginning of nursing process. You are going to reassess the patient again, then you diagnose, then you plan, then you now implement and evaluate. Evaluation ensures that nursing care is effective and patient-centered. Like I said earlier, that some school of thought said is no longer ADPIED, that is now ADPIED, ADPIED, and the last D means documentation. So what is documentation? Documentation is accurately recording all the care given to a patient and patient's condition in a medical record. And it is an important part of nursing process because it helps with communication, legal protection, and continuity of care, and it helps to prevent duplication of nursing care, the effort of nursing care. Today, we are ending our teaching on nursing process. If you have any question for me, feel free to enter my DM and ask, or you can ask your question in the comment section below. Don't forget to like, share, comment, subscribe to my YouTube channel. See you in my next video. Bye.